Have you ever really looked at your tongue in the mirror? Not just a quick glance while brushing your teeth, but a real, close-up inspection. That small organ you use for tasting, swallowing, and talking is also one of the most powerful diagnostic tools you own. Welcome to Levitas. Today, we are decoding the map on your tongue. We're going to explore exactly what different colors, coatings, and textures can mean for your nutrition, digestion, and overall health. This topic can feel a little strange, but it's incredibly important. So I have a question for you. When was the last time you noticed something unusual about your tongue? And what color was it? Let me know in the comments below, and as you're heading down there, please take a second to like this video. Your engagement is everything to the channel. The healthy tongue and the gut connection. First, let's establish a baseline. What does a healthy tongue even look like? A healthy tongue should be pink, not pale, not bright red. It should be moist, and it should be covered in small, tiny bumps called papillae. These are your taste buds. It's also perfectly normal to have a very thin, faint, light white coating on the surface. That's just a normal collection of bacteria and dead cells. But here's the key concept I want you to grasp. Your tongue is not an isolated organ. It is the very start of your digestive tract. It's the front door to your gut. Because of this, the microbiome on your tongue is directly connected to the microbiome in your stomach and intestines. In fact, a 2020 study in the Journal of Oral Microbiology found that the bacterial communities on the tongue coating of patients with gastritis were significantly different from those of healthy individuals. Your tongue is, quite literally, reflecting the health of your gut. Signal number 1. So, what happens when it doesn't look like that healthy pink baseline? Let's start with the most obvious sign, color. If you look at your tongue and it appears very pale, almost whitish, this often signifies a lack of blood flow or a low red blood cell count. Clinically, this is a classic sign of iron deficiency anemia. Your blood gets its bright red color from hemoglobin, a protein that uses iron to carry oxygen. When you're low in iron, you have less hemoglobin, and your tissues, including your tongue and the inside of your lips, can lose their normal, rosy color. This isn't just a theory, it's a frontline diagnostic clue. A 2017 study in the Journal of Family Medicine and Primary Care confirmed that tongue pallor is a significant clinical indicator of anemia, helping doctors identify it just by looking. On the other end of the spectrum, what if your tongue is bright red, sometimes called a strawberry or beefy red tongue? This is a sign of inflammation, known as glossitis. And in the world of dietetics, this points very strongly to B vitamin deficiencies, especially vitamin B12 and folate. These B vitamins are critical for cell turnover and repairing the rapidly dividing cells of your mouth. A 2018 review in the Journal of Clinical and Experimental Dentistry identified this type of red, inflamed tongue as one of the primary oral signs of these specific nutritional deficiencies. Finally, what about a purplish or blue-tinted tongue? This is a more urgent sign. A blue or purple color in your tissues, known as cyanosis, indicates poor circulation and a lack of oxygen in your blood. This can be related to heart or lung issues. A 2019 case report published in Korea's detailed a case where central cyanosis, a lack of oxygen in the arterial blood, presented with a distinct purple tongue, linking it directly to severe hypoxemia. If you see this, it's not something to ignore. It warrants an immediate conversation with your doctor. Signal number 2. Now, sometimes it's not the color of the tongue itself, but what's on it. Let's talk about coatings. Remember, a thin white coating is normal. But if you see a thick, white coating that looks like cottage cheese, this is the classic sign of oral thrush, which is an overgrowth of Candida yeast. We all have some Candida in our mouths, but our immune system and good bacteria keep it in check. A 2019 study in the journal Microorganisms explains that this balance can be disrupted, allowing the yeast to overgrow. What disrupts it? Common culprits include a recent course of antibiotics, which wipes out good bacteria, the use of inhaled steroids for asthma, or any condition that suppresses the immune system. What about a yellow coating? This is often a precursor to a more alarming condition we'll discuss in a minute. A yellow tint is typically caused by a buildup of dead skin cells and bacteria on the papillae. The bacteria themselves can produce pigments, or they can get stained by external factors. A 2021 article in Stat Pearls explains that the most common causes are poor oral hygiene, smoke, or a dry mouth, which allows bacteria to flourish. In very rare cases, it can be an early sign of jaundice, but usually, it's a hygiene and bacterial issue. Signal number 3. Beyond color and coatings, the actual texture of your tongue tells a fascinating story. We mentioned the bright red beefy tongue, but often, its most defining feature is its texture. It will look abnormally smooth and glossy. This condition is called atrophic glossitis, and it's atrophic because those little bumps, the papillae, have shrunk away or been lost entirely. This is why it looks so smooth. As the 2018 review from the Journal of Clinical and Experimental Dentistry reconfirms, this loss of papillae is a hallmark sign of chronic iron, B12, or folate deficiencies. Your body literally doesn't have the nutrients it needs to maintain your taste buds. Next, have you ever seen a tongue that looks like a map? This is called geographic tongue. It presents as smooth, red patches surrounded by slightly raised, white borders. The most interesting part is the patches can move and change shape from day to day, or even hour to hour. While it's considered harmless, it can make your tongue sensitive to spicy or acidic foods. For years, we didn't know why it happened, but new research is drawing a strong connection. A major 2020 meta-analysis in JAMA Dermatology found a significant association between geographic tongue and psoriasis, an autoimmune inflammatory skin condition. It suggests geographic tongue may be an oral manifestation of that same inflammatory process. Lastly, you might have a fissured tongue, which means you have deep grooves or cracks on the surface. This is almost always harmless, often genetic, and just tends to become more prominent with age. The only real health consideration here is hygiene. It's important to brush your tongue gently to clear any food or bacteria from those fissures. Signal number 4. Okay, let's address the one that sends people to the internet in a panic. It's called black hairy tongue, and it looks exactly like it sounds. The tongue can develop a dark, black or brown, furry-looking coating. I want to be very clear, this condition is alarming, but it is almost always harmless and temporary. That is not hair. What you're seeing is an extreme overgrowth of the filiform papillae, the same bumps that get worn down in atrophic glossitis. Here, they've become elongated, sometimes to 15 times their normal length. These long papillae then act like a net, trapping bacteria, yeast, food debris, and tobacco. This debris is what gives the tongue hair its dark color. A 2022 review in Clinical, Cosmetic and Investigational Dermatology details the common causes, and they'll sound familiar. Recent antibiotic use, heavy smoke, drinking large amounts of coffee or black tea, and, interestingly, using certain mouthwashes containing bismuth or oxidizing agents. The treatment is usually just to stop the offending cause and practice good oral hygiene, including using a tongue scraper. So, after all that information, some of it a little scary, some of it just interesting, what is the one thing you need to remember? Here is the doctor's verdict. Your tongue is a diagnostic tool, not a final diagnosis. It's a check engine light that prompts you to ask why. It is an invitation to get curious, not to panic. If you see a thick white coat, you ask, what's going on with my immune system or gut bacteria? But many of these common signs, the pale tongue, the bright red tongue, the smooth, glossy tongue, are your body's earliest and most visible warnings of nutritional deficiencies, specifically in iron and B vitamins like B12 and folate. Your diet, or your body's inability to absorb key nutrients, is writing a story on your tongue. Your job is simply to learn how to read it. Watch this video suggestion, it was especially picked for you. Also share, comment, give it a thumbs up, subscribe, and hit the bell icon. It helps a ton with the algorithm. Remain tuned for future videos to empower your health and fitness journey. So, stay healthy, stay happy, and keep going.